All right, today we're tackling a condition with a pretty complicated name, primary biliary cirrhosis, or PBC for short. But really, it's a fascinating story of mistaken identity, where your body's own defense system gets confused and starts to turn on itself. We're going to break down exactly how and why that happens.
So here's how we're going to break it all down. First, we'll go behind the scenes and look at the unseen attack that's happening inside the liver. Then, we'll figure out how to read the signs and symptoms it sends out. After that, we'll see how doctors get a definite confirmation, what the options are for managing it, and finally, what the future can look like for someone with PBC.
Just think about this for a second. Imagine your body's own security team, the one that's designed to fight off colds and infections, suddenly gets its wires crossed. And instead of going after invaders, it starts targeting your own healthy cells. That right there is the core of an autoimmune disorder, and it is the absolute key to understanding PBC. So let's start with that internal battle. What is really going on inside the liver when someone has primary biliary cirrhosis?
Okay, so PBC is an autoimmune attack, but it's an incredibly specific one. The immune system isn't going after the whole liver, not at all. It zeroes in on these tiny little pipes inside called bile ducts. As these ducts get damaged and destroyed over time, it creates a massive traffic jam for bile, which then causes a whole cascade of problems throughout the body.
So who does this tend to affect most? Well, the data shows a really clear pattern. PBC is much more common in women. And it often doesn't travel alone. It can show up alongside other autoimmune conditions, things that affect the skin or the thyroid gland. This connection really suggests there might be a common trigger deep within the immune system.
All right, so this internal attack, it doesn't stay a secret forever. Eventually, the body starts sending out some pretty clear warning signs. Let's take a look at how to read them.
The very first clues are surprisingly subtle. It's usually not pain, and it's not a fever. Instead, the most common first symptom is something called pruritus, which is really just the medical term for a deep, persistent, and sometimes maddening itch. And get this can show up years before any of the more obvious signs of liver trouble even begin to appear. Now, as the damage progresses, other symptoms start to pop up. You might see jaundice. That's a yellowing of the skin and eyes, which happens because the liver is struggling to clear out waste products. Patients also report this deep, crushing fatigue that just doesn't go away. We can also see skin changes like melanosis, which is a gradual darkening, or xanthomas. These are little fatty deposits under the skin that form because the body just can't process fats properly anymore. And that trouble with fats also makes it hard to absorb crucial vitamins like A, D, E, and K.
Okay, so you've got these symptoms. How do doctors actually figure out what's going on? How do they go from just a hunch to a real diagnosis? Well, that's where the lab work comes in.
Blood tests are where they find the biggest clues. The most important one, the real smoking gun, is the anti-mitochondrial antibody, or AMA. Finding this antibody is a huge red flag for PBC. Doctors will also see high levels of an enzyme called alkaline phosphatase, or ALP, which tells them the bile ducts are under stress. And finally, blood tests will often show really high levels of fats, a condition called hyperlipidemia. But to be absolutely sure, the next step is often a liver biopsy. Under a microscope, doctors are looking for a very specific pattern of inflammation that shows the bile ducts are under attack. And when they see that, combined with the positive AMA test, well, that's a confirmed diagnosis. It's the 1-2 punch that provides the definitive answer.
So, once the diagnosis is in, what happens next? The whole game shifts to managing the condition, and the strategy really has two main parts.
Treatment has two very different goals. First, you've got to manage the symptoms, right? For that relentless itching, a drug called cholestyramine is the main tool. It just makes life more bearable. But then there's the bigger, long-term goal, actually slowing the disease itself down. And for that, doctors prescribe ursodeoxycholic acid, a drug that has been shown to seriously delay the progression of liver damage and hopefully push back the need for a transplant.
But sometimes the medications just aren't enough. When the fatigue or the itching gets so severe that it completely destroys a person's quality of life, that's when a liver transplant becomes the next critical and often life-saving option.
And that brings us to our last section, looking ahead. How do doctors predict the course of this disease? How do they determine what the future holds for a patient?
Now, you'd think for a condition this complex, figuring out the prognosis would be just as complex. But here's the amazing part. The best guide we have often boils down to a single, powerful number from a simple blood test.
And that number is the level of serum bilirubin. Bilirubin is just a substance that builds up in your blood when the liver isn't doing its job right. And it turns out, its level is the most reliable crystal ball we have for seeing how the disease is going to progress over time. It's a surprisingly simple yardstick for a really complex process.